Hello everybody! Today I'm gonna try to answer the question, Teacher, gaano ba katagal kailangang ipag-speech therapy ang bata? At gaya ng ibang tanong, hindi naman iisa lamang ang sagot dyan. Masyado maraming consideration. But before that, if you find this topic or other topics like these interesting or helpful, don't forget to subscribe at tara usap tayo. Let's get talking. Hello, if you're new here, I'm Teacher Kaye and I'm a certified speech-language pathologist. Ang topic ngayon ay base sa mga tanong na parang, Teacher, gaano katagal ba namin kailangang ipag-therapy yung anak namin? Or gaano katagal ba ang aabutin namin bago matapos ang speech therapy? At dahil iba-iba ang bata, iba-iba rin ang response to therapy. Kaya hindi talaga may titiyak kung kailan matatapos ang speech therapy ng anak ninyo. But there are factors that we look at. For example, what is the need or the difficulty of the child? So I'm not a fan of using these words, but clinically we do need to use terms like if the problem is mild or moderate or severe. So some of the factors we look at to determine if it is something mild or severe is the level of assistance that a child needs. So kapag meron silang skill na hindi nila ma-perform on their own and they will need to have assistance, doon natin makikita. Yung assistance ba ay at every step kailangan bang hinahawakan yung kamay ng bata bago niya magawa yung skill? Or nagagawa ba nila even if your cues are, pakonti-konti lang? Pero hindi lang naman yun ang titingnan natin. Because for example, may tinutulungan akong bata na we consider as mild lang yung need niya. We also look at the child's stimulability or teachability. Ano ba yung response niya kapag tinuturuan siya? Mabilis ba ang pick-up ng bata? At dito papasok yung ibang considerations like frequency, intensity, and duration of the therapy program. Yung frequency ay gaano kadalas ba in a period of time nagsi-therapy yung bata. For example, is it once or twice a week? Is it 3 times a week? Is it every day of the week? Or is it just, let's say, 2 times a month? So yan po ang usapang frequency. So syempre, if the child is having therapy every single day, baka because of the hours na ipinupunla natin doon sa pagtutok doon sa bata, iikli, posibleng hanggang 2 months lang ang kailangan niya. Instead of if parang once a week lang siya nakikita ng therapist, then maaaring umabot ng 1 taon yung therapy program ng bata. Then we also have to look at the intensity of the therapy. As in, gaano kahaba ba yung every single session. Then after that, we need to look overall at the duration of the therapy. Gaano katagal na natin binibigyan ng therapy ng bata? Umabot na ba ng 3 months? 6 months? 1 year? So lahat yan ay pinaplano at rinirecommend ng inyong speech therapist matapos ma-assess ang bata. Kasi doon niya makikita, ano ba ang problema? How much help is needed? What kind of help is needed? And then they will be able to form their clinical impression and form a sort of prognosis. Makikita niya, sa palagay ko with this child's working behaviors, let's see, they can estimate siguro 6 months. But even when the program suggests that they see an approximate of 6 months, hindi po yan formula. Kaya wag pong magugulat if parang 6 months na tapos hindi na meet yung program. Because again, iba-iba ang bata and it still depends on the response of the child to the therapy. And of course, ang ultimate goal naman ng therapy ay matulungan yung bata or yung individual na mag-communicate. So we want to see kung gaano na nila na generalize yung concepts. I can make a separate video about generalization. How spontaneous their communication attempts are. As in yung mag-isa na siyang nakikipag-communicate either by gestures or by speaking. And for some speech and language delays, we also want to look at age-appropriate skills. So for example, we are working with a child that is chronologically 3 years old but is performing at a language age of 1.5 years old. I think I talk about this in my video about delay and disorder. So syempre, ang gusto natin is mahabol sana yung bata to the skills that are appropriate to their age. But this does not apply to neurodivergent clients. For example, alam na natin na may autism yung bata. So their developmental patterns will not follow what we typically know. So ang goal natin for autistic individuals is that they are able to communicate functionally, however that is, to the best of their capacities. And most importantly ay how much practice the child gets at home on a daily basis. And that is why your job as families, supports, guardians, parents are so important to the child. And I said this even in episode 1 na ang therapist nyo ay makakasama ng anak nyo, once, twice a week, but kayo kasama niya araw-araw. So your role is very important to how fast your child can better communicate. And that is why I have started to make so many videos on my YouTube channel to hopefully help you and give you more ideas of how you can stimulate your child's speech and language at home. I know that this was super quick, but I hope na yung may mga ganyang tanong ay naliwanagan ko kayo kahit papano. And if you have any other questions, I hope that I can connect with you on my social media accounts. First of all, please subscribe to my YouTube channel, Teacher Kaye Talks, and that's everywhere else on my Instagram, Facebook, and TikTok at Teacher Kaye Talks. And hanggang sa muli, happy talking at mabuhay!